We will now continue agenda item 3, matters arising from the World Health Assembly and the Executive Board. The relevant documents can be found in Euro/RC68/6 and Euro/RC68/informational document/7. Euro/RC68 informational document/8. Euro/RC68 informational document 9. This is a very important topic, and the outcome of our deliberations on the topic is an important element of report of President of the Regional Committee to the Executive Board. It is our opportunity to present the views of our region in the global debate. We will look at the different documents separately, so to give opportunity to clearly state your views. We will start with the review of technical resolutions adopted by the World Health Assembly that are of particular importance for our region. They can be found in document Euro/RC68/6, and I will invite Dr. Bekir Kilic from Turkey, member of the Executive Board and functioning as a liaison with the Standing Committee of the Regional Committee, to brief us. Please, Dr. Bekir, you have a floor.
Thank you, Chair. Good morning, everyone. Dear Madam Regional Director, distinguished delegates, colleagues. I'm giving this statement in my capacity as liaison member of the Executive Board to the Regional Committee and the Standing Committee. This year's World Health Assembly, during its 71st session, adopted the 13th General Program of Work. It will lead the work of the organization for the next 5 years, starting from next year, and as we discussed earlier this year, it will support member states in road to achieving SDGs. But we also adopted 16 resolutions and 16 decisions. My presentation will briefly summarize and highlight those technical agenda items and resolutions with particular importance for the European region that are not addressed during our discussions at the Regional Committee this week. In the area of communicable diseases, there were several resolutions adopted I want to bring to your attention. Resolution 61.3 on preparation for a high-level meeting of the General Assembly on ending tuberculosis was adopted. Within our region, the Tuberculosis Action Plan for the WHO European Region 2016 to 2020 towards ending tuberculosis and multi-drug resistant tuberculosis has been adopted in 2015 and supports the implementation of the resolution. Thanks to the Secretariat for scaling up their actions to support member states to implement multi-sectoral action plans for early detection, successful treatment, and improving program performance. Resolution WHS 71.16 was on poliomyelitis, containment of polioviruses. While our region is polio-free since 2002, containment of polioviruses remains the major challenge for the region. We need to maintain the sensitive surveillance system to allow prompt detection of vaccine-derived and Sabin-like type 2 poliovirus, both humans and in the environment. With regard to non-communicable diseases, I will not go further in detail on the preparation of third high-level meeting on the General Assembly on NCD prevention and control. I'm sure all of you have been actively involved in the preparation of the meeting, which will be convened next week in New York. Resolution WHA 71.6 on WHO Global Action Plan on Physical Activity 2018 to 2030, I beg your pardon, was inspired by the Physical Activity Strategy for the WHO European Region 2016 to 2025. We congratulate Secretariat for its continued support to member states to promote physical activity even during the Regional Committee this week. Resolution WHA 71.9 was on the infant and young child feeding. The European Food and Nutrition Action Plan 2015 to 2020 addresses the issues raised in this resolution. The Secretariat will continue to support countries in introducing, coordinating, enforcing, and evaluating measures to address the inappropriate promotion of marketing of foods for infants and young children. Resolution WH 71.14 was on the rheumatic fever and rheumatic heart disease. Indeed, there is no specific action plan in the region on these diseases, but they are covered in many of the resolutions and action plans we have adopted in recent years. With regard to health systems, I want to draw your attention to the resolution WHA 71.8 on improving access to assistive technology. In our region, this work is integrated in the work to increase access to quality and affordable pharmaceuticals and health technologies. Last year, we adopted the decision on strengthening member state collaboration on improving access to medicines in the WHO European region, and the regional office is documenting existing inter-country collaboration initiatives that aim to increase access to medicines and health technologies in the region. While the focus to date has been on medicines, collaboration can be expanded to cover also assistive technologies through adding expertise in this area as needed and claimed by the member states. And finally, in relation to preparedness, surveillance, and response, I draw your attention to decision WHA 71.11. Pandemic influenza preparedness framework for the sharing of influenza viruses and access to vaccines and other benefits. As you have read in the report, this decision allows to continue to work in the 5 priority countries in our region, which will increase country ownership and sustainability. It will also allow the valuable work of the regional office to maintain and strengthen the regional influenza network. Dear ministers, representatives, distinguished delegates, my colleagues, I only provided you a very brief overview of some elements from the matters arising at the 71st WHA related to our work and omitted some things we already discussed for the past 3 days in this regional committee. But it's clear that we have a lot to do, both globally and as well as within our region. Thank you for your kind attention.
Thank you very much, Dr. Bekir. Are there any delegates who wish to comment? If so, please raise your nameplates. I don't see any. We have not received also requests from the non-state actors, from NGOs. I don't see any requests. Then we now turn to the next document, Euro/RC68, Informational Document 7 on Draft Comprehensive Global Strategy on Health, Environment and Climate Change. Following Executive Board decision taken in January, decision EB 142/5, the Director General is requested to develop, in consultation with Member States, the global strategy. In accordance with decision World Health Assembly 65/9, the regional committees are asked to comment and provide input to the draft. I trust you all have revised the document. So without any further introduction, I will open the floor for comments. Are there any delegates who wish to comment? If so, please raise your nameplates. Austria, please.
Thank you, Chair.
Followed by Belgium.
Thank you, Chair. I speak on behalf of the European Union and its member states and former Republic of Yugoslav Republic of Macedonia, Montenegro, Serbia and Albania, also Bosnia-Herzegovina, as well as Ukraine, Moldova, Georgia, align themselves with this statement. As the European Union and its member states said at the World Health Assembly, climate change and environmental degradation affect people's health and development, increase the risk of conflicts, poverty and hunger, undermine human rights, and are a growing cause for forced migration. There are considerable inequalities. At the hardest hit are people living in poverty. In the case of climate change, small island states and other coastal areas are mostly affected, although the impact can be felt everywhere. Extreme weather events like heat waves, flooding, and storms don't only hit vulnerable groups. Droughts, fires, vector, and waterborne diseases require adaptation of health systems, even if we are not meet the mitigation aims committed to the Paris Agreement. The EU project Public Health and Climate Adaptation Policies in the EU compiles best practice examples of the member states. At the same time, tackling climate change might be one of the largest health opportunities of the century because of the potential health benefits of avoiding substantial impacts of climate change, together with the co-benefits of climate change, mitigation and adaptation. To achieve the SDGs, we need to work across agendas, including through a cross-cutting and preventive approach. We need to promote actions that are mutually reinforcing and that support co-benefits for the goals and targets aiming at more healthy societies. In the WHO European region, we reviewed the evidence towards environmentally sustainable health systems and elaborated a strategic document going beyond a climate-neutral health sector. The EU commends the DG's strong commitments for health, environment and climate change. We look forward to working with the Secretariat on the draft comprehensive strategy for health, environment and climate change as decided by the Executive Board in January. Finally, we are looking forward to engage constructively in the run-up to the high-level conference on air pollution and health that will be held in Geneva at the end of next month. Thank you, Chair.
Thank you, Austria. Belgium, please, followed by United Kingdom.
Thank you, Chair. Belgium fully aligns itself to the statement made by Austria on behalf of the EU and its member states. We thank the Secretariat for the draft WHO Global Strategy on Health, Environment and Climate Change. In Belgium, we have the fortunate situation to have the Federal Administration of Health and Environment under the same roof, allowing us to make the following suggestions. In general, we suggest to adopt the One Health approach throughout the strategy, not only considering the direct impact policies can have on health and health systems, but also the mediated impact policies have through environment and climate change on health. Thus, ultimately seeking human health as defined by WHO, but recognizing that this is only possible through environmental and animal health as co-benefits throughout all policies. This being said, we recall that health, as defined by WHO, cannot be under the sole responsibility of the health sector, but needs to be the goal of a whole-of-government approach. Therefore, multi-sectoral policies to promote health and environment cannot be led by the health sector, but the health sector has to take an active role to advocate and influence. Lastly, and in light of its recent governance revision, we wonder in how far the European Environment and Health Task Force will be impacted by the plans regarding the coordination of regional policy processes and the scaling up of regional platforms for environment and health governance. Thank you for your attention.
Thank you, Belgium. Delegate of United Kingdom, you have the floor.
Thank you, Chair. The UK aligns with the statement delivered by Austria on behalf of the EU and its member states. In addition, I would like to touch on some current activity in this area. The UK government has pledged that this will be the first generation to leave the environment in a better state than we inherited it. The UK has recently published a 25-year environment plan to further this aim. A healthy environment is essential for a healthy society, and the 25-year environment plan will promote both physical and mental health. The plan also recognises international biodiversity as a priority. The Climate Change Act 2008 requires an assessment every 5 years of the risks of the current and predicted impacts of climate change and the development of adaptation plans. Thank you.
Thank you, United Kingdom. I have no more delegations requesting for the floor. As well, we have not received any requests from non-governmental organization for this item. I will ask then Dr. Piroshka Oslin to respond to the questions raised. Please.
Thank you very much, Mr. President. I would like to thank the EU member states, Belgium and the United Kingdom for the positive feedback on the global draft strategy on climate change and health. I would like to mention that, of course, in Europe we have a very high priority, and we work very closely with our colleagues in headquarters in developing this draft strategy. And our future work in environment and health area will be, of course, aligned and informed by this global strategy. I would also like to mention a very important development in the European region that can be also very useful at the global level. And this is the WHO Environment and Health Gateway that my Division of Policy and Health Governance and Policy for Health and Wellbeing, together with Dr. Claudia Stein's division, developed together, which includes more than 350 documents in this area, tools, information, reports, in English and Russian, which is easily available on the internet, which is now an integral component of the WHO European Health Information Gateway. Of course, the European health process is a very strong platform to work on, and this is something that could be also a good model globally. And the European Health Task Force continue its work. It met in June when, among other things, this gateway was also discussed, and member states were informed about how to assess it, how to use it. So we closely work with our colleagues in headquarters, and of course inform about the development, also the European Health Task Force. So thank you very much for your support, and your comments will be consolidated and forwarded to our colleagues in headquarters. Thank you.
Thank you, Dr. Oslin. We now turn to the next document, Euro/RC68/Informational Document 8, on the elaboration of a roadmap regarding WHO's work on access to medicines and vaccines. In accordance with the decision, World Health Assembly 71, Document 8, a document has been prepared regarding the process to elaborate the roadmap for us to comment on. There is also an opportunity to send in writing comments, and the Secretariat would really welcome that. So without any further introduction, I will open the floor for comments. Are there any delegates who wish to comment? If so, please raise them. Austria, please.
Thank you, Chair. I speak on behalf of the European Union and its member states, the former Yugoslav Republic of Macedonia, Montenegro, Albania, and also Bosnia-Herzegovina, as well as the Ukraine, align themselves with this statement. The European Union and its member states are happy to see that WHO work is so extensive and covers the whole value chain of the questions of access to medicines. We share the view that all aspects of this issue need to be addressed. We thank the WHO for such a detailed document, which facilitates a common understanding regarding the WHO program of work on access to medicines and vaccines for the next 5 years. The activities included in the roadmap are all aligned with the organization mandate, and we do not wished member states to get involved in micromanagement of WHO's work within the organization's existing mandate. We need this extensive roadmap to be driven by a subset of key deliverables and milestones as requested in the WHO decision adopted last May, with a calendar of these outputs for the next 5 years. Those will allow us to organize our decisions at individual World Health Assemblies on a specific topic in any given year without having to cover every aspect every year. As a consequence, we wish the roadmap to be focused on those key deliverables and milestones and not on the granularity of the roadmap activities. Thank you, Mr. Chair.
Thank you, Austria. Switzerland, please, you have the floor.
Madame la
Regional Director, President, distinguished delegates, improving access to medicines and promoting the right to health and also strengthening medical research globally and the protection of intellectual property constitute priorities for Switzerland and are its explicit goals in our foreign policy on health matters. Now, access to medicine is something that all countries are facing, and solutions for this must be found at a global level. We therefore welcome the consultations on the roadmap on the WHO's work in this field. Switzerland supports the broader approach which entails which the WHO has adopted for the roadmap. It's vital that certain states were able to express their concerns with regard to research and development and intellectual property in the roadmap. We feel, however, that it is vital to integrate more things such as the behaviour of patients as well. We also support the proposal with regard to diagnosis. Switzerland is in favour of effective collaboration with international organisations, and everyone must do so within the framework of their mandate and with also with other actors with regard to the implementation of the roadmap. We would like to have more information concerning the time frame and the follow-up for its implementation. Thank you very much.
Thank you, Switzerland. I have no more delegates from member states requesting the floor, and we are moving to the non-state actors. We have requests for 2 oral interventions and 1 writing statement. I would like to ask first to the International Federation of Pharmaceutical Manufacturers and Associations. You have the floor, please.
Thank you, Chair. IFPMA represents research and development-based pharmaceutical industry worldwide and will provide the position and perspective of the global pharmaceutical industry. IFPMA welcomes the WHO's ambitious 13th General Program of Work, particularly around delivery of universal health coverage. A broad range of policies are required to holistically address barriers to access to medicines, particularly domestic investment in coverage schemes that reduce out-of-pocket payments, while simultaneously ensuring sustainability of future medical innovation. A WHO roadmap on access to medicines and vaccines can be useful if it facilitates a collective understanding of the key issues and catalyzes action that result in tangible benefit to patients worldwide. Creating this understanding of the wider context and key enablers for access, such as effective health systems, sufficient and sustainable treatment financing, supply chain efficiencies, investment in health workforce, suitable regulatory systems is fundamental to achieving innovation and access to safe and effective diagnosis and treatment. The Zero Draft identifies these issues, but there needs to be a clear and coherent plan on how these objectives should be prioritized and delivered, with meaningful timelines and outcome assessment. It must be based on the guiding principles of GPW and the World Health Assembly document A71/12. Though many activities contribute to improving access to medicines and vaccines, there is a need to prioritize and invest in those where the WHO has an advantage compared with other organizations and that provide value for money, are fit for purpose, and lead to achievable and sustainable improvements. Once such an impact framework is defined, there can be a sound basis for future substantive discussion. IFPMA continues to underscore the value of partnership, a vision strongly shared by Dr. Tedros, as evidenced in his speech in the 2018 World Health Assembly. By leveraging the experience, the skills, resources, and networks of our partners, our impact can be exponentially larger than if we were acting alone. To truly fulfill our mandate, we must make our partnership even deeper and stronger. Partnerships are a fundamental component for access to medicines and vaccines, but unfortunately, an integrated vision of collaboration is largely absent from the roadmap. In line with this, engagement with the private sector is also largely missing from the current version of the roadmap, despite the GPW specifically detailing the critical role and importance of the private sector in achieving UHC, including through innovation and investment. IFPMA and its members remain fully committed to achieve the goals as defined in the GPW, which draw upon and pursue health-related SDGs, and we look forward to playing an active role with the WHO and other stakeholders, both in terms of innovation and access. IFPMA members are currently engaged in over 900 health partnerships, many of which focus on health system strengthening. The roadmap needs to acknowledge that sustainable and forward-looking solutions to health system access challenges can only be achieved through continued medical innovation, which relies upon the provision of effective incentives, particularly strong and predictable IP protection, together with health system strengthening, supply chain management, regulatory convergence, and capacity building, comprehensive prevention, timely diagnosis, and effective primary health care. There is much that needs to be done, and hence focusing on areas like pricing and IP in isolation will not achieve long-term successful health outcomes, and therefore this must be linked to the core issues. For example, pricing transparency undermines the efforts to tailor the price for resource-limited settings. IFPMA looks forward to constructive and evidence-based discussions on the Access to Medicines roadmap, which will add value by creating greater clarity and focus by the WHO in its important effort to increase access to medicines and vaccines over the next 5 years for the benefit of patients worldwide. Thank you.
Thank you. The next speaker is Knowledge Ecology International. Please, you have the floor.
Thank you, Chair. Knowledge Ecology International holds that universal health coverage should underpin the vision for WHO's roadmap on access to medicines and vaccines. The WHO draft roadmap acknowledges that some of the greatest challenges to achieving universal health coverage stem from persistent barriers to accessing health services and to accessing affordable and quality-assured health products. A roadmap with robust language on transparency would reinforce the WHO's authority to explore norms and mechanisms to enhance the transparency of R&D costs, prices, and revenues. The lack of transparency currently impedes or delays many of the policies that would otherwise be available as policy measures to reduce the price of medicines and vaccines. In particular, without reliable information regarding the costs of R&D, the costs and results of clinical trials, private sector expenditure on the development of products, and expenditures on marketing and revenues, it is hard to design alternative policy measures to reduce the current prices of medicines and vaccines. On excessive pricing, we request the WHO to develop a best practices manual on the subject of the control of and remedies for excessive pricing by December 2020. The manual should compile expertise on various legal and technical aspects of excessive pricing, including the context-specific methodologies employed by member states for determining if prices are excessive and the mechanisms to remedy and control pricing abuses. With respect to the overarching theme of achieving universal health coverage, access will always be constrained and unequal without the delinkage of R&D costs from the prices of medicines, vaccines, and other health technologies. On biologic drug competition, we would request the WHO to consider new policies and guidelines that can enhance competition for biologic drugs, including greater transparency of know-how and access to materials in order to create highly competitive markets for biologic drugs. Finally, we request the WHO to produce a report on potential intellectual property and regulatory barriers for gene and cell-based therapies, including but not limited to CAR-T and CRISPR. Thank you.
Thank you. As I mentioned already, we have one writing statement from Thalassemia International Federation, and I would like now ask Dr. Kluge to respond to the questions raised. Please, Hans, you have the floor.
Thank you, Professor Amiran. As a reminder, the roadmap is the document that outlines the programming of WHO's work on access to medicines and vaccines, and it has currently 10 activity areas. Globally, 61 countries provide their comments, and from the 61, 22 were from the WHO European region. And the activity areas which receive most comments are three, the following. The first one, preparedness for emergencies. Second, fair pricing and financing policies. And third, the application and management of intellectual property. We acknowledge that this is a very complex issue, but as it was requested, that WHO is very committed to look at its comparative advantage with other organizations and exactly in the field to provide value for money, fit for purpose, and leading to the achievable and sustainable improvements within the SDGs and the Health 2020. Thank you for the interventions, which I also will convey to our Assistant Director General, Maria Angela Simayo, who was with us, in fact, till yesterday afternoon. And finally, a word of sincere appreciation to the member states who have been very active in this field through various initiatives. Malta was mentioning on Monday the Valletta Declaration, also the Benelux initiative, the Netherlands, who hosted the first Fair Pricing Forum, the EU presidencies, including the recent one, but also Belarus, which will host the second regional consultation on access for TB and HIV and hepatitis C medicines 21-22 November. Thank you.
Thank you, Dr. Kluge. We will now consider the last document under this agenda item, namely document Euro/RC68/informational document 9 on the collection of the best practice and lessons learned on health of migrants and refugees. In accordance with resolutions World Health Assembly 71.15, the Director General is requested to collect this best practice to contribute to the elaboration of the draft Global Action Plan on the health of refugees and migrants that will be presented to the World Health Assembly next year. Assistant Director General Dr. Guerra is here with us to take a note of your comments and eventually react to any questions raised. So without any further introduction, I will open the floor for comments. Are there any delegates who wish to comment? If so, please raise your nameplates. I see Austria, please.
Thank you, Chair. I speak on behalf of the European Union and its member states, the former Yugoslav Republic of Macedonia, Montenegro, Serbia, Albania, also Bosnia-Herzegovina, as well as Ukraine, the Republic of Moldova, and Georgia, align themselves with this statement. The global trend of increased migration is of major concern. We are well aware of the fact that tackling the causes and the consequences of the large movements of people that we have witnessed recently is a shared responsibility of all stakeholders involved, and we remain committed to tackling them. The health needs of refugees and migrants require special attention due to their vulnerable situation. The EU and its member states welcome the recent efforts undertaken by WHO and its regional offices on the topic of migration and health, and fully support the ongoing exclusive consultation process ahead of the development of the Global Action Plan to be adopted in 2019. The EU and its member states welcome the framework of priorities and guiding principles prepared by WHO in 2017 in consultation with its member states. The framework underlines fundamental principles and guidelines promoting a human rights-based approach to migrants and refugees' health. While noting, on the one hand, the disparities in national responses to the challenges associated with the mass migration flows, and, on the other hand, the differences of views regarding the solutions proposed in the Global Compact on Refugees and on Migration, the EU and its member states acknowledge that reference is made to the above-mentioned framework in both of them. In that regard, we call upon WHO to continue its close collaboration with relevant international organizations, especially with the UNHCR and IOM. The EU and its member states welcome WHO's global and regional efforts in collaboration with its member states to respond to the ongoing challenges and reaffirm the relevance of the first ever strategy and action plan for refugees and migration health in the WHO European region, adopted in September 2016. We are looking forward to the findings of the progress report on the implementation of the strategy that is to be presented at this regional committee meeting. The EU and its member states welcome the ongoing cooperation between EU and WHO, including through a grant agreement from the EU Health Programme to establish guidance for good practice and actions for different groups of migrants and refugees, such as children, elderly, and other areas. Robust evidence and good surveillance systems with more disaggregated data are required to develop informed policies and enhance quality health service delivery to refugees and migrants by competent health professionals. In addition, accurate communication and public information on the health of refugees and migrants is of paramount importance to eliminate discrimination and stigmatization, as well as barriers to health services and care, and to offer the required conditions for mobile populations to enjoy the human rights to health and have a healthy life. Voices of migrants should be included in the decision-making process on the service they will benefit from in order to promote smooth and efficient integration. Finally, the EU and its member states remain committed to engaging in efforts on the international level, especially with regard to the development of the Global Action Plan. Thank you, Mr. Chair.
Thank you, Austria. Switzerland, you have the floor.
Regional Director, President, distinguished delegates, the current challenges in terms of migration do not only concern the European continent. On the contrary, migration is a global phenomenon. We are delighted with the completion of the work on the Global Compact on Migrants, and this is a process that Switzerland was deeply involved in. We welcome the fact that this pact makes reference to the framework priorities and the guidelines that have been developed recently by the WHO. The development that is of the WHO Action Plan for Migrant Health will help us build on the compact. We welcome the work along these lines. We need to find the resources to take into account the health of refugees and migrants in our policies. We can only rise to these challenges if we adopt an intersectoral approach and if we have better international cooperation and exchange good practices. I thank you.
Thank you, Switzerland. We have no more delegations from the member states requesting for the floor, and I would like to ask the observers, International Office for Migration, please, you have the floor. International organization.
They are not here.
They are not yet.
Okay.
Thank you. Then I will ask ADG Dr. Guerra to respond to the questions raised.
Thank you, President. Thank you, colleagues, authorities. I want to make a few comments on the current on the current situation. Everything started here, as far as WHO is concerned, in this region. This region has opened the door to consultations, to a dialogue, and to several considerations from the technical, scientific, as well as from the humanitarian and legal viewpoints that are being duly considered by the global level that is now building on the Global Action Plan draft, which has been published for consultation, and that will be additionally illustrated in the next couple of weeks in Geneva, when we will have a consultation session with all the member states. The first issue is the European region not only has opened the door to this, but has also built on a solid knowledge and capacity to draw lessons based on the evidence of facts. It has been contributing systematically to structure the knowledge hub that is now ready and crucial to derive any kind of evidence-based information, communications, data, and strategies. This is something extremely relevant for whatever will happen in the near future. As you know, the situation is still fluid. It calls for flexibility by the international organizations, by the UN system, as well as by member states in the different aggregations and constituencies. It is a very changing and challenging world, which comes with highly political implications and financial implications for several states that have contributed in migration management. You know that several events in the next few months will take place in different areas of the world. The UN Secretariat for Migration, the Migration Network, will be established in Geneva by mid-October. The Secretariat will be chaired by the Special Envoy of the UN Secretary General, and the Standing Committee, the Standing Secretariat, will be staffed by IOM. Several subgroups will be formed accordingly, and the public health sector will be driven by WHO, which will come with an additional responsibility in trying to make sure that all the voices of member states are duly represented. In December, in Morocco, there will be the formal adoption of the UN Compact for Migration. It will be an essential event where several different opinions will be discussed, but the key point is that the compact will be adopted and will be our reference for the future work. We have tried to anticipate that into the drafting exercise for the Global Action Plan that will be presented to the Executive Board in January, to be further adopted by the WHA in 2019, as foreseen by the resolutions that the WHA took last year. The intersessional period between the Executive Board and the WHA will be a consultative period for all of us. We will try to engage as much as possible with the other partners within the UN system, with the Global Fund, with Gavi, with several partners in the international arena, but mainly and most of all with member states, with NGOs, and with the civil society by and large. This leads me to the second point I want to make, which is the aspiration that we all have in drafting the Global Action Plan is to move towards integration. Integration of information systems, integrations of the capacity to deliver services according to a minimum standard of quality and of the nature of services, independently from the country that will be requested to deliver these services, integration of access to medicine, to vaccines, to treatment, to preventive services. And finally, the integration of confidentiality or protection of the rights base that the migrant community by and large deserve. This will lead us to try to find a balance between operations on the ground, the humanitarian and development continuum, We will have to look at the forgotten of the forgotten, who are the IDPs in several countries of transit, for instance. We will have to assist countries in developing their own national action plan, which will have to be costed. We will have to promote and offer the WHO comparative advantage in, for instance, ensuring continuity of care and service delivery at the cross boundary during the migration pathway. All in all, I think that the comments we are receiving from member states on the Global Compact draft, which has been published, are rather positive. They indicate that not only there is a strong interest in continuing this collaboration between member states and the international agencies and WHO in particular, but there are also ideas, there are also creative solutions that can be shared by member states. In this respect, I think that our responsibility is to acknowledge these contributions and making sure that the global action plan and the national plans are flexible enough to accommodate any kind of innovative issues, of innovative capacities and responses that will come from the continued consultation with member states. Therefore, I welcome your contributions. I acknowledge the role that Switzerland has had in drafting and in assisting the drafting of the Global Compact. It has been a very difficult and challenging task, but it has been accomplished, and we are all extremely happy to acknowledge this. Let me finish with just one comment, saying that given the current political situation in several member states and in regions, what is essential is that we develop a proper, strong communication strategy which is based on evidence of facts, preventing any manipulation of what data and the evidence tell us. Thank you very much.
Thank you very much, Dr. Guerra. This brings us to the end of our deliberations of this agenda item.